In my role in health policy, my colleagues think the election is a break before November. That it has no meaning. They talk to mid-level people at HHS. It will go on. The ACA will not be affected. Money for innovation, the biomedical research, none of this is altered by the outcome of the election. And I'm apologizing to you ahead of time because I'm going to tell you that the election matters, and I'm going to show you why. Now, if I were making grand rounds with you, I would see things that I would get very upset and everything. And you would say, well, that's what you should expect, Bob. It's a clinical setting. So I'm going to show you data, and it's politically oriented, and you're going to get upset. And I'm going to say, you would ask me to be happy with your clinical data. I'm going to ask you to have some patience with my political data. So first of all, this is an election that, let's see if we get this, hang on, back up, that should matter to no one. It's an off-year election. Most Americans are paying absolutely no attention to this thing. So why does it matter? It turns out there are 7 groups that forecast elections, and all 7 are really stymied. It's a 50-50 chance that the minority party will be the majority in both houses at the end of the election. It's a 50-50 chance it won't. The reason, just for some humor, you do these forecasts is so you can pontificate at meetings and predict 3 weeks ahead. And here it is, we're 3 weeks ahead and they can't pontificate. They just don't know what the outcome's going to be. So you say to yourself, who cares? But it turns out the reason, and that's why I push this issue with leadership audiences, is that we remain quite polarized in this country about what to do about the ACA and federal funding and federal support for all types of innovation in medicine and healthcare. And the polarization is what I'm going to break down. It turns out to be in the nuclei of the core of parties, not in the person on the Topeka Turnpike who cannot, as Jim says, name who the Vice President of the United States is. So from them, we do not expect much, but I will show you in a moment that many of them will not turn out. And so the people who turn out have stronger feelings for this, and that is how the ACA turns out. So briefly, let me give you the forecasting. 7 groups, and I concur with them, believe that the House of Representatives will in fact remain Republican after this election. That's the case even though it voted 45 times to repeal the ACA, close the federal government down, and cut the NIH. There is accountability up in heaven, but it may not be instantly in the current election. But the race that is really going to decide who governs is the Senate. And so what I'm going to show you very quickly is that the Senate races are not about Massachusetts. And so my apologies, I do a lot of polling in Massachusetts, and then I do a lot of national work with groups. And my colleagues in Massachusetts kind of believe we're like the rest of America. And if you're in the polling field, you're not. So the people I interview out would say, I heard you were at a meeting, they showed a slide with Lenin on it. And you go, huh? For that, not surprising at all. Texas is not Massachusetts with warmer weather. It really is not. For that, so here are the 14 states at the moment that either have competitive races or have open seats. The point I need to make is, so this is going to decide the majority, whoever wins the bulk of the 14 states. And so they are not states that we spend a lot of time on if you're in health policy. We whip to New York, to Massachusetts, to California, maybe a quick stop in Connecticut for a paper. There is no Montana, Kansas, Colorado, Louisiana, Alaska. Who knows what the health system is in Alaska? I mean, it just turns out the 14 together. So it turns out that, and I'm sorry, I apologize if somehow the society's uncomfortable, we'll take the slide away. So Gallup surveys 175,000 people every 2 years, and they ask them whether or not they consider themselves politically moderate, liberal, or conservative, and then they rank it by state for that. So I'll promise I'll never mention this again, but we are not typical on that list of 50 states. So we are number 2. And so of the 14 I just showed you, none of them are in the top 10 liberal states. Secondly, 11 of the 14 rank among the 25 most conservative political states. For that. So this is not a random selection of Americans' views of what should happen in the Congress. next time. This is something which was not predicted to happen, and I have tried to get out of being the reporter of this when people keep doing poll after poll. So this is an aggregation of 400 polls from 21 polling organizations. So this isn't a Bob poll or a Smith poll. This is basically all 400. What does it say? I'm going to simplify you. The same number of people who did not like the ACA today was passed don't like it today. We've made a lot of great progress, education, reports, commissions, not a whit change. So the 8 million figure is announced. They borrow a banner from the old Bush banner, you know, victory today. They go out, we got the 8 million. And what happens the day after? Opposition to the plan goes up. So I'm going to show you in a moment the reason why opposition changes is that what has happened in the United States is two separate dialogues. The one dialogue is finally this country is going to cover uninsured people. We've been at this for 60 years. We are finally going to do it. The second dialogue is this bill is bad for middle-income people, and it's bad for the country in the aggregate. And there are two separate dialogues going on. And the people who are scared, and I'll show you who they are, about it's not good for middle-income America, don't want to look at the uninsured numbers and the issues and who's better. They're afraid of the bill. For that, and I'm going to show you, because it's important for leadership, this is not something Charlton Heston just brought down from the mountain. There have been very distinct efforts in this country of spending hundreds of millions of dollars to make people sitting at home in Arkansas sweat every time they hear the word Obamacare. Here is why Massachusetts and California, though leading in what happens, leading on ideas about how we're going to innovate in the healthcare system, are not about what the election is. So this is support for the ACA in Massachusetts, California. Good news. Bad news is there are no competitive races. That's some of the states. So you go from 40% in Colorado down to 29% in Arkansas. And for that reason, Bill Clinton is living there every single day telling you how good it works and everything else. But we are in a different culture in terms of what the debate is about. And so Jim and I were talking about this. When you're in public health, when you see people who don't believe in something you think might be good, you think it's lack of education. We need another report, a statistics, a briefing, something on the air that will do this. If you're in politics, you believe is that after a while, some people get political things in their head and they block out information. It's ideology, it's party, it doesn't matter what you show. They're not going to change. What I'm showing you here is that after 4 years of education, we haven't moved the split. So if I say I'm a Republican, I go, I don't like Obamacare for it. If I am a Democrat, it is one of the greatest achievements of this century for that. And it hasn't changed a great deal. And for some reason, independents are more worrisome about this bill than might be expected. So let me, and I'll show this to you in a second, but there is a misunderstanding about sort of how parties make broad decisions when they win. In this election, I'll show you in a second, basically 6 in 10 adults will not choose to vote. That's the standard for it. They will drive by, they will curse. They may even call Jim on the talk radio to talk about how awful the results are. They just won't stop to vote for that. So if I'm in politics, I know the 4 out of 10 actually make the difference. So who are the 4 out of 10? So if I am a political leader, I ask, if I win, if for somehow the Republicans or Democrats majority, I ask, who the heck voted for me? And so take a look at this. If the answer is, I'm a Republican senator, I would have won 80% of the Republicans and 55% of the independents. So when I get to town to talk about the ACA, I'll show you in a moment, I am not going to sound like the senators from Massachusetts. I'm just not. If I'm a Democrat, I win 80 to 85% of the Democrats, and again, 55% of the independents. So the story is the same. Is healthcare an issue? It is one of the issues, but it's not the top issue. But again, what people miss is the 14 states are going to be decided by about a 4% gap in who votes. So when you have 3 or 4 issues, it turns out they all matter because it's very, very close. If it's not very close, then the top issue matters. But I appeared in March on a panel, and it was the economy, stupid. We went home. Then I appeared on a panel in July. It was immigration, stupid. Everybody knows it's immigration. Now I'm on a panel, and this is the most recent, and healthcare is there, and there's a terrorism, immigration, and economy isn't dominant. So there are 4 issues that really matter. For those who wonder where the sequestration comes from, people who vote federal budget like sequestrations. I was just going to tell you that. For that, and so they just want to hold domestic spending down. Allow me to be professor a half a minute, and then I'll go back to just on the politics side. So when you pick up the New York Times and you see all Americans think something or other, in politics that doesn't matter a lot. Why? Because in this election, so you start out and then they say something about registered voters. That's 73% of the sample. So you have the New York Times, 73% said, I'm a voter. And then you look down and only 4 in 10 actually will vote. So what elections are about are what those 4 in 10 care about. And we're not sure yet who the 4 in 10 are. But this is what we know, and this is what it is that if you say to people who are likely to vote, they say to you, I am highly likely to vote. Are you more or less likely to support a candidate that is for the ACA, more likely to support one who isn't or doesn't make a difference? What you're shocked by is there are more people to vote against a candidate who supports the ACA than to vote for him, with more than 1 in 4 saying, I don't give a whit one way or the other. It's not an important issue to me. And so if you split that out, oh, it's random. They just didn't watch CNN News that night. No. The first bar is made up of Republicans and conservative independents. The second bar is made up of Democrats and liberal independents. For that. And that's where they are, and they haven't changed. So the question is, how many of one or the other are actually going to vote in those 14 states, and that's not settled. I have the privilege of polling routinely in Massachusetts and having my colleagues just embrace every piece of work I do. It's so wonderful. Because in Massachusetts, 61% from the day it was thought of liked this bill. I know many of the audience may not, but they do. And it went after 4 years to 63%. And then, so you say to them, has this bill made things better or worse in the state? And it's 2 to 1 better, with the rest saying it made no difference. You ask the general population, how about the ACA? And more people say it made it worse than better for that. Now, this can't be based on data. But it can be based on what talk radio show I listen to. So the impact of the ACA on the country by date. You can watch all of that. I don't think the people interviewed here did. So Democrats say mostly positive, and Republicans, 73% say it's had a terrible impact on the country for that. So now I'm just tell me who shows up, who is going to be there on that day, and I'll tell you sort of where they stand on these issues. The same thing is, did this bill impact people's families? Well, the good news is most people say, as they should, at the moment it didn't impact them at all. But of those who are impacted, more somehow feel they got up in the morning and they are worse off by this bill for that and for that. So this is what happens. This is something that I pay a lot of attention to. This is called a value question. And the question has to do with your support for universal coverage. It's been asked since 2000. Do you think the federal government should guarantee coverage for everybody? And through the Democratic and the Republican primaries, basically 64% of people said, of course. It's time America has reached the point that we cover everybody. Since the bill has been implemented, we've now switched with more people saying, I don't think the government should go ahead with universal coverage. Why? They got scared that something about universal coverage means something that they're going to lose their weight, they'll pay more, and it cannot be on facts because we know they don't know a lot about what's in the bill. So once again, the question is, oh, Bob, let's put out a chart book and explain to everybody how important universal coverage. And then I say, well, for that to work, then there has to be a randomness of who doesn't agree. Well, there's no randomness at all. Basically, if I'm a Republican, I've decided that this is the wrong way for our country to go. If I'm a Democrat, this is a core value for me. And so the reason why I started out with where Massachusetts is on the liberal chart, because if I say I'm a liberal, I say this is a core value in America. If I say I'm politically conservative, I say we're going down the wrong trail. Well, what did I tell you? That there are more conservatives in those 14 states than there are liberals. So that's why the election, and it's not just over this issue. So this is the other point I just need to make. Because it's invisible, but it's not been invisible. And there's a research group that I have been involved with. I have no tie at all, but I have given more of their work to media organizations at all. And it's a large international advertising research group that monitors who purchases advertising. And what they did was, since the bill was passed, just sample all across the country who bought an ad that had the word ACA or Obamacare in it. And what they discovered, what is unique, so let me make the unique point here. We have always had political campaigns. We buy ads against everything. Look at the gambling referendums, this or that, millions of dollars of ads. Once it's over, we stop. Once it's over, we stop. So this is the advertising after the bill is passed. $445 million is bought. 94% of it has an anti-ACA message. And so, they're running it in Massachusetts. So what they did was allocate this by what area you bought the advertising. Well, without straining your eyes, they bought it in the states where the competitive races are going on. And we are proudly in an advertising-free environment. You are protected from this, as are our colleagues in California. No one is wasting a dime on an ad in California or an ad in Massachusetts. But when you get dark green, that's $500,000. So I have appeared, since this came out, on a number of panels with private sector leaders, all of which held hands and said, we are all behind this. We are all behind this. I said, great, all behind this, okay? And then they came out with another report. Over the summer, somebody not on the stage, holding hands, singing, we're behind it, bought 37,000 negative ads. I don't know who they are. In medicine, we just talked about transparency. There's no transparency. You cannot find out who bought this. I checked with my wife, she didn't buy it. Who bought the 37,000 ads that said this is awful for you middle-income people? We do not know about this. So this is of likely voters, just done. What should you do with the law? And what's important to look at is, there are 4 choices, and I can explain later why we use the choices that the Gallup poll uses, which has scale back after repeal. So the first is repeal. Most voters do not want this bill repealed, except 56% of Republicans want the bill repealed. And so the scale back is higher for that. So when you go down the other end, keep the law as is and expand it. The secret is the plurality of Democrats do not want to keep the bill as it is. They want to expand it, which has huge implications for 2016. If I'm running in a Democratic primary, most Democrats do not look like they want to hear you say, we love it as it is, keep it. They want it to be bigger. But if I win with a lot of Republican voters, I am going to come to town in January thinking we have to scale this bill back. One other thing, people keep saying to me, he has those fuzzy numbers, I don't know how much attention we should pay to them. It's not real people, okay? So a study was just done by Brookings looking at the websites of both Democratic and Republican primary candidates. Turns out that 75% of Republicans who ran in a primary this year put on their website, if elected, I will get rid of that bill. Now, I don't know what evidence we need, that they'll get to town and they'll deny it. Maybe they will. For that, the rest, not one of them said, I'm for doing this. On the Democrat, surprise, it was all the other side on the website. So the election turns out. So what does this in reality mean? And the reason why, in the long-term issue, I want to leave people with. So the short-term issue is this bill cannot be repealed as long as the president's there, but it can be scaled back. for that. Likewise, the Republicans cannot get an alternative passed, even if they are the majority, through and signed by the president. But budgets really matter. There are lots of things, subsidies, implementation, innovation, research, lots of things that are in a budget that could be very, very different under this environment. And the tone could be very, very different. So I'm going to close, but the point I have is I have to get on the stage by telling the election matters. The real point I'm trying to make, and really bothers me, we have a problem in this country in polarization over issues like this. We cannot evolve an acceptable healthcare system where people could come to town feeling they have a mandate to pull the feathers out of the chicken, whatever it is. We have to find some way to reach agreement. This is a health problem, and this is a serious political problem. And I talk to audiences that are not politicians because I am convinced they cannot solve this themselves. I think they are caught in a trap. Where donors and primary voters drive you to take incredibly extreme positions. And when you get to town, you're rewarded back home by not doing anything with them. And we have to find a way out of this. The systems that we're all discussing actually require a functioning federal role. I don't have to agree to what it is, but it has to function, and there has to be some bipartisan agreement. We are not in the short term heading in that direction, and we have to get out of this. But the election, unfortunately, will matter. Questions? Nobody fainted, so I feel better.
This is where you first of all applaud for Bob Blendon. Thank you.